Hello guys, so we start our new set of lectures. It's endocrine system, and endocrine system will start with endocrine system histology. Histology of endocrine system, of course, in physiology class you also discuss it. Which organs are included in endocrine system? Of course, it's our hypophysis, also known as pituitary gland, which is under control of hypothalamus. We will discuss it also a little bit. We also have pineal gland, which is also present in the brain. Today, it's not in topic of our discussion today. We have thyroid glands, parathyroid glands, which are incrustated into the thyroid gland. And then we have thymus gland, which we will discuss in lymphoid tissue. Then adrenal glands, which are present above the kidneys, which functional, which we will discuss today. Pancreas, and in pancreas, not entire pancreas is discussed. It is discussed only islets of Langerhans. These islets of Langerhans which produce insulin. It will be discussed in digestive tract pathology. Then ovaries in females, it's discussed in female reproductive system, and testes in males, it will be discussed in male reproductive system. So today our topics of our discussion are pituitary glands, thyroid and parathyroid glands, and adrenal glands. So let's start. So in general, so what are exocrine glands? What are glands and what are exocrine and endocrine glands? First of all, you should differentiate it that exocrine glands are those glands which produce it on surface of epithelial cells, on the surface of membranes. So might be mucous membrane, might be on surface of skin, might be on surface of any other open cavities in our body, urinary tract, digestive tract, or somewhere else. Genital tract also. So everywhere when it's produced on the surface, and has a direct or indirect contact to outer environment. So it means exocrine gland. But endocrine gland is when it's secreted directly or indirectly to the blood, and it carries its function first of all to initiate action of other cells. These chemicals which are produced, they are not active itself. We have this set of receptors on different target cells. So try to understand the idea that these hormones, they don't do the action like it's explained in physiology, like it's explained in even in endocrinology. They say that adrenaline causes contraction of smooth muscles, of blood vessels, and that causes blah blah blah. So it try to understand that actually not these causes. It's like a message which is shared, and it activates. These hormones activate receptors on surface of target cells. That's what you should understand first of all. So target cells are cells which carries this type of receptors. So that's why hormones do nothing. Hormones just a message which causes activation of the cells. So that means the hormonal signal. Okay, next. Endocrine system consists of organs like pituitary, thyroid, parathyroid, adrenal, and pineal glands. So they also might be like clusters of cells, which are not entire organ, like pancreatic islets of Langerhans, like we discussed today. Theca interna of the ovary, which produces estrogen, and progesterone in case of yellow body formation. So this and testes which produce testosterone, and individual cells like enteroendocrine cells of digestive tract, which produce just localized action. So you know that in some subject you heard about this, is that in histology you discussed we have exocrine secretion, endocrine, but also we have two more, paracrine and autocrine secretion. So paracrine secretion is exactly about the things that enteroendocrine cells, which produce hormones not for large distance action, but for localized action. So that don't forget that this system is also present. that not only by blood, sharing of these hormones should be not only by blood but also by interstitial liquids. These interstitial liquids and it affects only surrounding tissues. But today we'll discuss only those glands which produce it directly into the blood, and from the blood it reconstitute and redistribute all over the body and cause effects of target cells. So for example, actually we have some endocrine function even in non-endocrine organs, so which used to never named as endocrine organs, like kidney. In kidney we have juxtaglomerular apparatus of kidney, which produce different hormones. So we discussed it a little bit in pathology. In the heart, where we also produced, for example, natriuretic hormone. Liver, which produce proteins, so like albumin, globulin, and fibrinogen. It's endocrine function of liver. Thymus, which produce thymosin, so which cause activation of T lymphocyte differentiation, and placenta, which also same as corpus luteum or yellow body of ovary, produce progesterone and other hormones which are necessary for pregnant women. Then endocrine cells. Endocrine cells have diverse structures, functions, and embryological origins. So that's why we can't say that it's one common system. We systematize it just because it's very convenient to say about them like one system. But actually, by embryologic development, they might be like mesodermal, ectodermal, and even endodermal in origin. So that's why here they are not in one system, but it's very convenient to explain them. We have endocrine system, which and endocrine and hormones which are appear there. They control our body actions. Okay, and we can subdivide the chemical consistence. These hormones are subdivided into steroid hormones like cortisol, testosterone, estrogens also. Then amino acids and amino acid derivatives like thyroxine, epinephrine, or might be even peptides and proteins. Peptides and proteins, so they are typically present in pituitary gland. Pituitary gland usually produce peptide hormones, and insulin is also peptide, which is produced by Langerhans cells of pancreas. Okay, step by step we'll discuss this a little more detailized. So endocrine organs. So what are the common features of all of them? These organs, they contain fenestrated capillaries. I want to remind you this. I will remind you this in cardiovascular system histology. But anyway, fenestrated capillaries. What are they? They are capillaries with a large fenestra, so like holes in their membrane, so which allow water-soluble compounds to easily penetrate there. So that's it means what? So actually, when a gland produces something, it embeds into the capillaries, and then capillaries carry it all over the body. So it facilitates the entry of the hormone into the bloodstream. So that's you understand it. And we used to name that all glands, even endocrine glands, they are epithelial cells. And if you remember properly the histology of epithelial cells, most of epithelial cells show polarity, but endocrine glands, they are exception, and they do not show polarity. So we have one exception in thyroid gland, and I'll show it to you a little later. Okay. Then together the nervous and endocrine system coordinate functions of all body systems, and their function integrated as a neuroendocrine system. So you will understand from physiology. That's why I can skip these definitions. Let's directly start to talk about pituitary gland, also known as hypophysis in tradition of Soviet Union classification. We name it like hypophysis only, so we don't name it. We don't have any other name of this. Okay, and pituitary gland consists of two different glands. So actually they are embryologically absolutely different, they are functionally absolutely different, but they are localized in one area, and surgical approach to them is similar. That's why we name it like one gland, which is divided into two glands, and it is known as adenohypophysis and neurohypophysis. Adenohypophysis, according to name, adeno, so it's adeno, so it's epithelial in origin, it's ectodermal in origin, and ectodermal portion of during development, so form adenohypophysis, and responsible for most of pituitary gland actions. And here we have neurohypophysis. According to this, you can say, yeah, as name implies, it's neuro means derived from brain, derived from nervous system, and but together they are mixed, so attached together. So it's easier to properly say it's attached together, and together we can name it as pituitary gland. Okay, then let's talk about adenohypophysis. Embryology of adenohypophysis. So here is the embryological picture. So how it is evolved. You remember in embryology we discussed that here we have embryo now looks like hollow tube. Yeah, that outside we have ectoderm, inside we have endoderm, and after neurulation forms the neural tube, which is shown here, neural tube. So which is also ectodermal in origin, but it's a little another quality now, so it gains some other qualities, and you see. And what happens here? Actually, in pharyngeal region of this embryo, which is this place is known as oropharynx ectoderm, present this outpouch. This outpouch is named as Rathke's pouch. This ectoderm, this typical ectoderm, same from which our skin is evolved. I mean, epidermis of skin is evolved. This Rathke's pouch is formed. It is our future adenohypophysis. But from other side, growing of neuroectoderm goes. So this outpouch of neuroectoderm, and this is future neurohypophysis. Yeah. Neurohypophysis or pituitary gland, neural origin of pituitary gland. You see, and during the formation of bones, yeah, this Rathke's pouch is insulated from larynx, from larynx, and gradually this connection, every connection of this pituitary gland with the oral cavity and pharynx is dumped, yeah, is stopped, and then you see now it's absolutely far away, so divided by bone, from the place of origin, this adenohypophysis. But neurohypophysis, so as you see, it was connected to the brain, and it's still connected to the brain, and that's why here we will discuss this, different parts of this hypophysis of this pituitary gland, and you will mention how it reflected. And you see, yeah, one more thing I wanna mention. Rathke's pouch, you see, here we have cavity. So this little cavity, this is known as Rathke's cavity, Rathke's vesicles will form here. So it will be necessary for future neurosurgeons. Okay, let's turn back here. You see, what's the structure? What's the anatomical structure of pituitary gland? So it contains pars distalis, pars nervosa, and pars intermedia. And so it's a main part. So, but here on upper side we have a pars tuberalis and infundibulum. So let's name it step by step. So adenohypophysis predominantly forms the pars distalis. Large portion of pars intermedia is made of adenohypophysis, and pars tuberalis also made of adenohypophysis. So you see, it's like envelop the nerves, pars nervosa. Then pars nervosa contains not only, neurohypophysis contains not only pars nervosa, but also contains infundibulum. And by this, what's the function of this infundibulum? So you know that above the hypophysis we have hypothalamus. Hypothalamus. So a few words about hypothalamus. It's like our director of the function of pituitary gland. This hypothalamus, it gains all the so it's all the connection between nervous signals and our endocrine system is going on here predominantly in hypothalamus, and all the information first of all collected in hypothalamus, and then hypothalamus decides which hormone should be produced or not or shouldn't be produced. Okay, also I want to pay your attention that very close to pituitary gland goes the optic chiasma. Optic chiasma. So optic chiasma is optic nerve. So there's a branch of optic nerve which connects eye with the brain, and it goes very close to pituitary gland. And pathology of pituitary gland can cause also vision problems, and we'll discuss it. So, but be in charge. And it can suppress, and also optic chiasma as one of symptoms of pituitary gland pathology will be some eye problems or vision problems. Okay, that's why it's subdivided into, and yeah, we without delving deeper, we subdivide all the pituitary gland into two parts: posterior lobe and anterior lobe. But if we divide it histologically, once again, it's divided into 5 parts, like pars distalis, pars tuberalis, infundibulum, pars nervosa, and pars intermedia. Sorry. So, pars distalis. So, what is the pars distalis? It's the largest part. It's 95% of entire adenohypophysis is pars distalis. That's why usually we don't talk about other parts when we talk about adenohypophysis. It's pars distalis. Pars tuberalis. So it's a collar of cells around the infundibulum of the neurohypophysis. It's a rest of 5% of adenohypophysis. Then, and here we have a cystic remnants of Radke's pouch. Cystic remnants of Radke's pouch there are small cysts which are present here. Here you see there are little cysts. Here are little cysts. And there are remnants of Radke's pouch. Remind you, this is Radke's pouch. Radke's pouch. And then only few remnants remained here, like cysts. Here, so that's it like proves us that it's derived in this way. Then pars intermedia. Pars intermedia forms the posterior wall of Radke's pouch. So you see everything which is still adenohypophysis, but which present more anteriorly. So posteriorly, sorry. More posteriorly, it is also adenohypophysis, but it forms the pars intermedia. Then, but in this part we have pars nervosa. When after the pars intermedia we have pars nervosa. Neurohypophysis possess pars nervosa and also infundibulum. Pars nervosa and infundibulum. So, and that's classification, anatomical classification. So that's adenohypophysis possess pars distalis, pars tuberalis, and pars intermedia. So this adenohypophysis name. Neurohypophysis includes pars nervosa and infundibulum. But according to clinical terminology, we have anterior lobe of pituitary gland, which includes pars distalis and pars tuberalis only, and posterior lobe pituitary, which includes pars nervosa, infundibulum, and pars intermedia. So you see, all the confusion in classification is gate on pars intermedia, which plays very low role in endocrine function. So just you can remember it. So that posterior lobe is not always neurohypophysis, and adenohypophysis is not entirely anterior lobe of pituitary gland. So it's because of this pars intermedia. It's better to remember it because I think most tricky questions of PMC or any other tests is based on it. Then cell types of adenohypophysis. So finally we have to discuss cells of adenohypophysis. So and we have two main types of cells in adenohypophysis. They are chromophils and chromophobes. Chromophils and chromophobes. Chromo, as you remember, it's a color. Yeah. So with those cells which collect some color, they are named as chromophils. And chromophobes are those which are not collecting any stain on it. So you see, and chromophils, we have acidophils and basophils. Just for your mentioning, so just prevent your confusion, chromophobes, they have no well-known function. Might be they play a role of like basal cells, so which like stem cells, which are used for reproduction of the cells. Might be, but function is unclear yet. But chromophils, they are active cells which produce some specific hormones. Take a look. Acidophils. Acidophils, they are two cells, somatotropes and mammatropes. As name implies, somatotropes produce somatotropic hormone, hormone or somatotropin, or another name is growth hormone. So usually in the tradition of English-speaking countries, its name is growth hormone, but in Russian it's more commonly named as somatotropin. They have anabolic function, so which promote the growth of bones and other tissues and connective tissues too. And mammatropes. Mammatropes, as named mammo, it's a breast gland. Yeah, it's secrete prolactin and stimulates milk production. I have a lecture, please wait a little bit. Okay, let's continue. Mammatropes secrete prolactin, which stimulates milk production. So this prolactin, we have very common syndromes which are known as hyperprolactinemia. So in males and in females, which sometimes causes challenges in pregnancies and getting pregnant. Okay, we'll discuss it later. So you see, these acidophils are only two types of cells, somatotropes and mammatropes. Then basophils. Basophils are, as name implies, so it is colored with basophilic stains, basic stains. I mean, so we have tyrotropes, gonadotropes, and adrenocorticotropes. So tyrotropes produce TSH, thyroid stimulation hormone. Yeah. Then gonadotropes produce two types of hormone, like LH, luteinizing hormone, and FSH, is follicular stimulation hormone. These hormones they play a very important role in regulation of female menstrual cycle, and even in males it stimulates the growth of sex cells like Sertoli cells and Leydig cells. They regulate the Sertoli cells and Leydig cells activity in testes. So that's why in both in males and females, there are this luteinizing hormone and follicle stimulating hormones. They are follicle stimulation hormone. They are controlling the sexual reproduction in our body. That's why they are named as gonadotropes. Gonada means sexual glands. Then adrenocorticotropes. Adrenocorticotropes, so as name implies, it is responsible for adrenocorticotropic hormone release. So adrenocorticotropic, adrena, it's adren, so it's above the kidney. Yeah, it's above. Ren is a Greek word of kidney. Cortico, cortex, tropic, feeds. Yeah, so this adrenocorticotropic hormone feeds the cortex of adrenal gland, and adrenal gland produce glucocorticosteroids. Glucocorticosteroids are controlled by ACTH, adrenocorticotropic hormone. Then chromophobes. Then these chromophobes, you see. Chromophobes are present here. They are not gaining some specialized color. So you see, unlike basic cells, they have very basophilic cytoplasm. Acidophils, they have very acidophilic state, but here and here and here we see cells which, so here, for example this, yeah, now here we have a lot of cells which don't gain any color. So when function is unclear, might be they're remnants of undifferentiated cells. Maybe they have no function. Maybe they have a hidden function which we don't we didn't properly understood yet. Okay. So this templates you can use for learning. Then distribution of cell types in the adenohypophysis. So it's pars distals contains all 5 types, 5 cell types. Pars tuberalis contain gonadotropes only. So you see, pars distals contains gonadotropes too, but pars tuberalis is exclusively concentrated on gonadotropes. Pars intermedia, it contains basophils predominantly, but function is so unclear because it's very small and function is very challenging to understand the real function of pars intermedia. But actually it might be just a remnant of embryological development, so which plays no role. Okay, regulation of adenohypophyseal function. So adenohypophyseal hormones, they secrete under the control of hypothalamus, and we have releasing hormones. Yeah, so you heard about adrenocorticotropic releasing hormones. So means they are neurohormones which causes activation of these cells which we discussed here. Might be acidophils, might be basophils, and individually somatotropes or mammatropes. Yeah, this gonadotropin releasing somatotropin releasing hormone, have prolactin releasing hormone, gonadotropin releasing hormone, thyroid stimulation hormone, tyrotropin stimulation hormone, and adrenocorticotropin stimulation hormones we have. They are produced. So you see, we need a hormone to produce hormone, and this is a new level of regulation. Yeah, it happens, as I said, in a hypothalamus. And also as well we have stimulatory hypothalamic hormones. We have inhibitory factors. So we have inhibitory factors which suppress the activation of them. So of course you understand it. It's necessary for positive and negative feedback. Positive feedback, so means if you already have a lot of these hormones, so you need to stop the production of this hormone. But if you have little production of this hormone, so you need to stimulate this hormone production. So this is a negative and positive feedback happening here. Okay, and now let's talk about pars nervosa, or posterior lobe of pituitary gland. So it is just composed of nervous tissues. So it is glial cells of the brain. Yes, so you remember these glial cells of the brain. They just like, it's like extension of hypothalamus only. And some neuroendocrine cells, they still present here. So yeah, here they're still present here, and they produce hormones. Which hormones you can remember? It's oxytocin and vasopressin. Oxytocin so is responsible for smooth muscle contraction during the parturition, during the delivery. Yeah, contraction of uterus is controlled by oxytocin level, and also oxytocin is one of hormones which is related to feel of relation, so not love hormone, but it's a relation hormone. I mean, it controls the behavior when you so monogamy. Okay, let's name it like monogamy hormone. So which allows you to be only with one person for a long time, and also with in your binding to your children, for example, also regulated by this hormone. So okay. And also vasopressin. This hormone controls the blood pressure by retaining of sodium. So large increase of the production of this hormone causes retention of sodium and subsequent retention of water in the blood. So by volumic features, it causes fulfillment of body with water and salts. So, and for example, you heard about diabetes mellitus, yeah, but you didn't hear about diabetes insipidus. So this diabetes insipidus usually happens when this due to overproduction of this vasopressin hormone. Okay. So, lack of production, I mean, of course, lack of production. Then thyroid glands. Thyroid gland. So thyroid gland is located in neck region around the larynx and trachea. It is composed of 3 lobes. So sometimes 4 lobes. So it depends on classification, but doesn't matter. So it's thyroid gland is controlled by thyroid stimulation hormone, as we discussed. TSH is produced by pituitary gland, and it controls the production of 2 main hormones, T3 and T4. T3 and T4, which are necessary to maintain our metabolism rate. So these metabolic hormones which controls the rate of metabolism, and might you remember this Warburg effect we discussed in the case of cancer, yeah. And actually these hormones activate the Warburg effect in cells. So slightly, they cause less effective production of ATP, but more productive formation of tissues. So that these hormones activate these effects. Okay, and you see here, what are they? What are these structures? Of course, they're parathyroid glands. Parathyroid glands, they are incrustated inside the thyroid gland, and they have another function we will discuss a little later. But now let's concentrate our attention on thyroid gland histology. Thyroid gland histology, so first of all you have to understand the conception of follicles. So thyroid gland is derived from the laryngeal pouch, one of laryngeal pouches, which are pharyngeal pouch, of course, which we discussed in embryology in the first lecture of embryology. You remember this thyroid follicle, and as well they are derived from epithelial, from endoderm. They have a lot of features of endodermal originated tissues. Here we see this is normal histological structure of thyroid gland. Here we see this. They are follicles. They are follicles. Yeah. You see, in the middle we have a gel-like substance, and here we have cells, cuboidal epithelial cells. And you remember, I used to say that endocrine glands, they don't have polarity, but this is exception. Thyroid gland is exception. They have polarity, and you see we have basement membrane here, and we have apical domain here, and that's why But this is endocrine gland. But what is this gel mass? Gel mass, actually, it is a substrate for T3 and T4 formation. Function of these cells, these follicular cells of thyroid gland, so which are present in the follicles. Now, they are follicular cells. Actually, the capturing of iodine pulling it into this area. And another function is formation of thyroglobulin. Thyroglobulin, which is not hormone yet, but is substrate for hormone formation. This thyroglobulin contains a lot of tyrosine endings, thyroxine, and when iodine is joined here, so thyroglobulin gets rich with iodine, and this thyroglobulin, especially thyroxine remnants of this amino acid thyroxine, so it gets rich with iodine, and then this thyroglobulin, which already with iodine, is get captured back by the cells, by follicular cells, and destroys this protein on the amino acids, and iodinated amino acids like tyrosine and triiodtyranine, they come into the interstitium, into the bloodstream, and that's how T3 and T4 appeared in the bloodstream. Once again, these cells produce thyroglobulin into this gel. The same cells pull all the iodine of the body into this area. Then here inside this gel happens the process of chemical joining of iodine with some thyroxine components of this thyroglobulin. Then this thyroglobulin, iodinated thyroglobulin, is captured by follicular cells, destroyed by proteases, and then iodinated amino acid like triatyranine and tyrosine, they are returned back into the bloodstream. So I hope you understood this idea. So if not, so please read some information about it. It's very interesting, and by this you can understand the reason of this arrangement. So you see, it was a function of follicular cells. But here we have some other cells. You might mention, here we have some other cells. They are known as parafollicular cells. Parafollicular cells, they are also named as C cells or clear cells. They're present between follicles. You see, they're present between follicles, and they have absolutely other function. Their function is a formation of calcitonin. And in the topic of bone histology, you might mention this calcitonin. And even in physiology of endocrine system, you might be discussed this that calcitonin main function is a collection of calcium into the bones. Yeah, so the capturing of calcium from the blood into the bones. And in calcitonin, like decrease the calcium level of blood. Decrease the calcium level of blood by capturing of them into the bones. And it is antagonists. The C cells, they're like antagonists to to the parathyroid gland. This calcitonin is opposite to parathyroid gland and parathyroid hormone. Okay, they are not related to follicles. They have absolutely independent function, but you have to keep it in mind that thyroid gland, and that's why during the surgeries on thyroid gland, so it might give some challenges also with calcium metabolism. Okay, it's belong to diffuse neuroendocrine system also. Okay. This is a structure of parafollicular cell. It contains a lot of vesicles, and they produces in these vesicles we have this calcitonin hormone, and it is released gradually into the interstitium, and then from interstitium it is captured by fenestrated capillaries into the bloodstream and distributed all over the body, and affect the activity of osteoblasts. Osteoblasts in the bones, which cause the calcification of bone matrix. Okay. Synthesis and release of thyroid hormones is explained. I explained it to you, so this mechanism is shown here. I want you to observe it by yourself. Then parathyroid glands. Parathyroid glands, so I already shown it to you. Yeah, in thyroid gland, in the deepness of thyroid gland, we have something like islets inside it, and they're known as parathyroid glands. And here we have two different cells. There might be Schiff cells and oxyphil cells. Schiff cells, they're major cell type. They are arranged in cores or clamps. Yeah, the structure is polyhedral shape, and their main function is formation of parathyroid hormone. So that's pretty obvious. Yeah, so the principal cells of this gland is producing parathyroid hormone. But here we have large accumulation of oxyphils. Oxyphil cells. So oxyphils, they are eosinophilic stained cells. And this is one more example when we don't understand what the role of the cells. We don't exactly know. So we have large portion of the cells. Might be some requirements are there, but we don't understand the function yet. They don't produce some obvious hormone, and erasing of this portion of this portion on laboratory on the lab animals, so gives nothing. So so they don't die if we just erase it. So might be just another remnant of embryologic development which gives no any opportunity for us in future. So here I want to pay your attention. Here we have blood vessels around, so you see a lot of blood vessels here also. Blood vessel starts, so it's necessary to gain this secreted components of this gland. And here you see also capillaries. A lot of capillaries are present in the deep of this gland. And actually here we have much less capillaries in oxyphilic part. So must be it doesn't produce enough hormones, so and is this hormone which is produced there is not so important. Now finally let's talk about adrenal glands. Adrenal glands are pair glands, each located at the superior pole of a kidney. You know it's as name implies, adrenal glands above the kidney. And that's why sometimes you can name it epinephric glands. Yeah, epinephric. So actually, epinephric is as similar as adrenal. And so epinephric, epi is just adrenal means in Latin. Epinephric is in Greek, from Greek. So that's but absolutely the same. And that adrenal gland, it's an epinephric gland is the same. So subdivisions. So adrenal glands are subdivided into the cortex and medulla, and this cortex and medulla are derived from different tissues. It resembles some, and little bit of formation of this resembles the formation of pituitary gland. Yeah. So cortex is derived from the same remnant, from the same tissue as kidneys are produced. It's a mesoderm. It's major steroid producing glands. You see, mesoderm, it is the same mesoderm from which will be formed males and females gonads, like ovaries and testes. So, and that's why cells which are present in the cortex of adrenal glands will be very similar, very close to cells which are found in testes and ovaries. And functionally they are also similar. They produce steroid glands, and they produce not only but in adrenal glands this steroid so variety of steroid hormones which are produced there, they are much larger than in testes and ovaries. But here absolutely another place derived structure which is known as medulla. Medulla is derived from neural crest cells. Neural crest cells, I want to remind you that during the neurulation process, some cells of angle of neural tube, they detached from the neural tube, and they like sparse all over the body, and some collection of these neural crest cells, they organized this adrenal gland, and they have very close connection to nervous system. And this medulla, so and now you can imagine it. So medulla is very deeply, very tightly connected to nervous system. It produces some hormone which is controlled by nervous system. It is epinephrine and norepinephrine. So you see, actually medulla, we can claim that medulla by structure it resembles the typical sympathetic ganglion. It's just usual sympathetic ganglion which produces same hormone. You know that norepinephrine, it's an absolutely normal neurotransmitter in our nervous system, but here it produces the same neurotransmitter, but not to other synapse, but it produces directly into the blood. And we have a more evolved form is epinephrine, also produced directly into the blood. And they are short-lived hormones. So okay, let's discuss it in details in next slides. So adrenal glands are surrounded by dense capsule. Okay, this is anatomical view of this. So you see it has triple founding with the blood. So we have by left inferior phrenic artery. So from branches which are known as left superior suprarenal arteries. It has supplement with the blood by left middle suprarenal artery, and also directly it goes directly from aorta. And here we have renal arteries supply the adrenal gland, but this branch left inferior suprarenal artery and vein, so which supply it with the blood. So you see, from three directions, it is this gland is filled. So it which allows this adrenal gland to be very sustainable for hypoxia. So because in any case, so blood will come there and oxygen will come to this organ. So cortex. Cortex is composed of steroid secreting cells, and they are subdivided into the three zones of cortex. Okay, this is zona fasciculata, zona reticularis, and zona glomerulosa. Okay, we'll discuss a little later. Then numerous lipid droplets filled with cholesterol, precursor for steroid hormones. So we discussed it a little bit. That cholesterol, we used to blame cholesterol in all bad things which are present in our body, but actually cholesterol is a substrate for steroid hormone secretion. If you're pretty fluent with biochemistry, you can observe the structure of steroid hormone and cholesterol, and you can mention that they are pretty similar. And secretion is by diffusion with no hormone storage, so they don't store these hormones because it's impossible to store steroid hormones. Steroid hormones, they're water insoluble, they're lipid soluble, and that's why they easily penetrate the cell membranes, and as well as they produce, they are released outside, and that's why we don't have storages of these hormones, and they are produced and released in blood directly. Here we have this structures. Here we have this subdivisions. You see, this is cortex, and this is medulla. Okay, and let's talk about zones. Zona glomerulosa, it's beneath the capsule. Zona fasciculata, it's in between them, and zona reticularis. So let's talk about this from this diagram. Zona glomerulosa, so it is most responsible for mineralocorticoid production. Mineralocorticoids, and most brightful example is aldosterone. Aldosterone regulates the sodium and water retention in our kidneys. So and it controls not only sodium but other minerals, but mainly it is responsible for sodium retention. Then next one, zona fasciculata. Zona fasciculata. So this is mainly responsible for glucocorticoid production, like cortisone and hydrocortisol and cortisone. So these hormones are mainly responsible for gluconeogenesis. Gluconeogenesis, I remind you what is gluconeogenesis, and we discuss it in pathology also, that these glucocorticoids causing the depression of protein synthesis, but formation of more glucose from proteins. Instead of protein formation, they use amino acids to produce glucose and glucose derivatives. So that's the same hormones also used in suppression of immune reaction, because antibodies and all the factors which cause the inflammatory response, they are based on proteins protein production, and overexpression of these glucocorticoids will be named as a Cushing syndrome, and we will discuss it in next lecture. And this Cushing syndrome, one of typical effect of Cushing syndrome is depression of immunity. And then third layer, it is zona reticularis. So zona reticularis is mainly responsible for formation of androgens and estrogen. So mainly here named as androgens, like testosterone and testosterone-like hormones are produced. And you can say, so we have testes, yeah, so why are they produced here? But you know that testosterone is compulsory not only for males, but in females testosterone is also necessary for normal development of muscular system. Normal development, even for female reproductive system, is inevitably should encounter with testosterone. And that's why the testosterone which produced here, it allows to have a basic level of testosterone. And even males who undergone the castration, yeah, so they have some little level of testosterone. Yeah, this portion, this zona reticularis actually gives approximately 5% of all testosterone of male and 100% of testosterone in females. Yeah. So, and below it we have neuroendocrine cells. They are adrenal medulla, so which are producing the epinephrine, also known as adrenaline. So which classically is a similar words, but just one in Latin, one in Greek. You see, this is histologic structure. Once again, reminder for you. So this one is derived from mesoderm, intermediate mesoderm, but this one is derived from neural crest cells, nerve cells, actually, neural crest cells. So here is also medulla, yeah, neural crest cells. It is histologically, it looks like ganglia. Okay, then these zones are discussed. So this is embryological development of this. You remember, might be you not remember, but we should discuss it. So during the embryo folding, so here forms the urogenital ridge. So as name implies, its urogenital ridge is responsible for formation of urinary organs and also for genital organs. And this ridge is responsible for this site of collection of cells. It's primordium of fetal cortex. It's mesodermal cells of splanchnoplevra, also known as dorsal mesentery or splanchnoplevra, is collected in the urogenital ridge. But from other source, from neural crest, this neural tube, folding neural tube, these neural crest cells also settle nearby, and fetal cortex cells, they just get surrounded by mesodermic cells, and their redistribution causing this picture. This is fetal cortex, this is permanent cortex, and then from permanent cortex produce zona fasciculata, glomerulosa, and reticularis, and medulla is formed by neural crest cells. Okay, so this is here you can see the function of them. So picture of cells of zona glomerulosa, zona fasciculata, zona reticularis. It's for your self observation because I already explained it. Adrenal medulla. Yeah, adrenal medulla is composed of chromaffin cells. Chromaffin means they can attach chromatic stains. So, and by structure it represents sympathetic ganglion cells and produce epinephrine or norepinephrine, which I already explained to you. So this is histological structure again: capsule, zona glomerulosa, fasciculata, and zona reticularis. And then here we have medulla, which produce adrenaline. And here in the middle we have central adrenomedullary vein, where all the adrenaline, if it's produced, so influx here and distribute all over the body. That's it. Thank you for attention. I hope you enjoyed. So only 40 students remained. I guess it's because of namaz time. So I hope you will observe this lecture in record later. Thank you for attention. See you next time.
Thank you, sir.
If you have any questions, you can ask.
No, sir.
Thank you.